think it's just us still. Welcome, everyone. Welcome, everyone. Jania, great to have you. We're going to make you co-host so that you can share your slides when it gets to your part.
Sounds good. Thank you. Good afternoon.
Do I keep saying good morning? I might need to change that, shouldn't I?
Oh, no, I think it was me. I was going to tell you good morning.
Nakaya, great to see you. Thanks for joining us.
Thank you for having me. Good morning.
Good afternoon, everyone coming in. It's so great to see you here today. We'll get started in just a few moments as folks are coming in. We'll give everyone about one more minute. Everyone ready to get started? Good afternoon. My name is Jean Workman Elms. I have a new name at the beginning of this year. I'd like to welcome everyone to I think this is our third Crucial Conversations, the state of infant and maternal and infant health in Guilford County. We are excited to gather with you today to share announcements and updates of the collective action movement of Every Baby Guilford. We'll be sharing the most recent data, infant mortality data, and we'll also learn and hear from one of our programs in the collective action movement, as well as spotlight one of our extraordinary partner organizations. We'll wrap up today's event with a crucial conversation with diverse community members, hearing their perspectives regarding the data and our collective work. Before we get started, I'd like for us to take a moment of silence to acknowledge the infant deaths that have occurred in the past year. Next slide. Every Baby Guilford's mission is to ignite and mobilize Guilford County through partnerships and unified strategies to eliminate racial disparities and prevent infant deaths. Our vision is that every baby and family will have equitable opportunities and access to achieve the healthiest start in life. I'd now like to turn it over to our esteemed Public Health Director, Dr. Van, who will provide a welcome from Guilford County. Next slide.
Thank you, Jean. Thank you so much. Good afternoon, everyone. I am delighted to welcome you all to this year's Crucial Conversations. our annual community discussion focused on the vital work of preventing infant mortality here in Guilford County. As the Public Health Director, I am both honored and privileged to be here today. This gathering represents our collective commitment to safeguarding the health and well-being of our youngest, most vulnerable residents. The health department is responsible for everybody's well-being from birth all the way to them passing. So this cycle of life is something that we are dedicated to and that we're seeing every day in the health department. Together, we have achieved significant milestones, and these are the stepping stones for future successes. So we will not stop here. We will continue to do this really hard work. But again, there's always more work that needs to be done. So that's where I think we all really come in place to do this collective action plan, just like Jean has mentioned. I think that today's discussions are crucial for several reasons. First, they will allow us to share with you our progress over the past year in reducing infant mortality rates, and there's a lot of work that has been done over the last year. We will hear from our speakers, just like G mentioned, on the incredible work that is being done in the community, their stories, experiences, and that will provide you with some invaluable insight into the effectiveness of the programs that are being implemented and the initiatives that are existing in the community right now. Also, we will also discuss challenges that we face. Despite the successes, there are still disparities that exist, particularly amongst Black and Brown communities. These disparities require our immediate attention and action. By working together, we can address the root causes, continue to implement the targeted strategies that we have put together, and to ensure that every baby in Guilford County has an equitable opportunity for a healthy start in life. And then lastly, during our crucial conversations, we will love to explore new strategies, interventions, innovative strategies for the future. The landscape of public health is ever evolving. We're always learning new things that we can do things to be more effective in the work. So it is crucial to us to stay ahead of the curve. And that's where you all come into place, because together we can explore this new future for this work that we're doing. Your input, your ideas are not just welcome, but they are essential to shaping the future of our efforts. Your presence here underscores the importance of this issue and the power of the community collaboration. It is really through our shared knowledge, experience, dedication that we can continue to make meaningful impacts. I want to express my heartfelt gratitude to all of you for all of the work that you're doing day in and day out for this cause, for this mission, for being here today, for your commitment and support to driving and the driving force behind our success. Thank you again. I'm honored to be here. Jean, thank you so much for organizing this, putting together the Every Baby Guilford team. Thank you for your continuous dedication and passion for this work. None of this would be possible without you. So thank you all. And I will pass it back to Jean to move us through the agenda for today. Thank you.
Thank you, Dr. Van. Next slide. Well, just as Dr. Van was acknowledging numerous individuals, we can't have the day go by without acknowledging our Guilford County Board of Commissioners for their unwavering support, naming infant mortality reduction as a strategic priority. Every Baby Guilford is a public-private partnership, so we are grateful to the Every Baby Guilford Board of Directors, both with Public Health, the Department of Health and Human Services Division of Public Health, both lead and guide the work of Every Baby Guilford. Through our funding with the North Carolina Department of Health and Human Services Women's Health Branch, as well as funding from Ready for School, Ready for Life, and the Guilford County Partnership for Children, where we are so grateful for the funding behind the work here. Today, I can't not acknowledge our Every Baby Guilford team. We have grown this past year with contracting with doulas. And so I briefly want to state the names of our team members: Noelia Turner, Leandra Vernon, Elbia Altamirez, Tiara Booth, Brianna Grant, Marquita Baker, Jada Rogers, and Angelica Mickle make up our team. And then in addition, we've added 9 community doulas: Quadasia Sharp, Kayla Crouch, Shanetta Arnold, Deja Dixon, Angelica Villanueva, Kalia Moore, Lauren Fairley, Jalea Jeff, and Tamika Smith. You are all rock stars within our work. We partner with Hey Awesome Girl, Root Cause Institute, 6 Dimensions, as well as Riot for Change as implementation partners. And today could not have taken place without the support from Dr. Mark Smith. And lastly, we'll be hearing from Jania Williams, Daniel DeShazer Tab, Javon Johnson, Nakia Brooks, and Quadasia Sharp later on in our program. Next slide. So I'm going to turn it over to Root Cause Institute, Consuela Green, and we're going to see who is in our space today with us.
Hi, everyone. Good afternoon. I am going to quickly launch a quick poll so it'll pop up for you. This is just for a chance for us to see all of the different roles that are represented here in our space together today. So if you don't mind, take a few minutes, a few seconds, probably shouldn't take you too long, but feel free to check off all of the roles that apply for you. Are you a resident? Are you a parent? Do you work in the education space? Just kind of take a minute to go through the poll and check off all of the options that apply for you. It'll be great to see who's in our virtual room today. A few more of y'all. We're about 70%. We're moving up. We're moving up. Thank you for everyone completing the poll. Awesome, awesome. So we're gonna close the poll now to just get a sneak peek of who's all in the room with us this afternoon. Awesome, awesome. So many of you all are current Guilford County residents. A number of you all are parents, either of children under 18 or over 18. I'm repping for the parents of children over 18, and working across a wide range of spaces in Guilford County. So thank you all so much for kind of virtually saying hello to us using the poll, but I also would love to invite any of you all to use the chat as a way to engage. The webinar platforms can feel a little bit more flat sometimes. So we'll be in the chat paying attention and chiming in and saying hello to folks. So feel free to say hello in the chat as we go along. Thank you.
Well, before we delve into the calendar year 2022 data, let's briefly review what's led to a collective action movement. Keep going. Next slide. We continue to anchor our understanding of racial equity and cross-system change work using a groundwater approach of the Race Equity Institute. The Every Baby Guilford community movement is looking at the longstanding racial disparities in infant mortality as a groundwater cross-systems challenge. We are naming racism as the contaminant to that groundwater. We know that outcomes are worse for Black communities across different systems, our healthcare, justice, and education, to name a few. We believe the work at each level, the fish, lake, and groundwater level, is important. And we also believe if we don't address the contaminant in the groundwater, systemic racism, then we are only addressing symptoms and not the root causes, or the root causes will continue to be persistent and those symptoms will reappear. During the design and planning phase in 2021, the community was really clear that we believe systemic racism is the primary root cause of the racial disparities in maternal and infant health that leads to infant mortality. Next slide. Some key takeaways from the groundwater approach is that racial inequities look the same across systems. To show that there are inequities, but not why there are inequities, leaves too much open to interpretation. The socioeconomic differences do not explain racial inequities, and inequities are caused by systems regardless of culture or behavior. Some of the key drivers, next slide, key drivers of infant mortality in our community as developed from a community-wide approach from 2020 to our launch in 2021, was that persistent and pervasive historical racial disparities shown in the data over the last number of decades made it very clear that the quantitative data is part of the story, but is not sufficient to answer the question, why have these racial disparities persist? We have continuously stated that it is important that we anchor the realities of these persistent and pervasive racial disparities in a historical and social context. There's a wealth of research that answers this question, and when we embarked on the strategic planning process that shaped the Every Baby Guilford work that we're doing today, it was one of the guiding questions that framed community dialogues and planning. Through research and community conversations, it was clear that local initiatives to address these high infant mortality rates need to include individual level interventions that do not explicitly address racial inequities. There are a variety of factors that create these inequities, including systemic racism and implicit bias, that impact equitable access to high quality care and improving health outcomes. In 2021, with over 100 Guilford County people representing diverse backgrounds, we looked at the local data, the impacts of history and contemporary drivers of maternal and infant health inequities. And community members were very clear. We can't keep blaming individuals, especially Black parents, for longstanding maternal and infant health outcomes that has kept Guilford County's infant mortality rate high. Next slide. And while we have been anxiously waiting for the 2022 data, I'm again very grateful to Dr. Mark Smith. He's our retired epidemiologist for Guilford County Public Health, and he's worked tirelessly to get this data to us. But before we go into the data, I want to remind everyone that this is on a 2-year delay. We are looking at data from 2022. We were just 1 year into the launch of Every Baby Guilford at this point in time. And we were wrapping up still some of the impact from COVID with many of the COVID subvariants that were continuing to spread during that time. The impact of COVID on social drivers of health was still being experienced as it is today. So drum roll, I guess, so to speak. We can go to the next slide and begin looking at the data. Since launching the Collective Action Strategic Plan, and we launched in June of 2021, Every Baby Guilford has continuously stated that maternal and infant health outcomes are key indicators for gauging the overall health and well-being of a community. The North Carolina 2022 infant mortality rate remained unchanged from 2021 at 6.8 deaths per 1,000 births. This rate has been stagnant in recent years and kept North Carolina among the 10 highest infant mortality rates among states. Guilford County's rate was on a downward trend for the past 2 years. However, in 2022, we experienced a close to 16% increase in overall infant mortality rates. It still remains higher than the state and national rates. Next slide. Year-to-year data shows many fluctuations at the county level. Again, we were hopeful that we were on a downward trend. However, we had less overall births and an increase in infant deaths from 2021, which led to that close to 16% increase in our overall infant mortality rate. Guilford and Forsyth counties still remain 2 of the highest in the state for counties of our size for infant deaths. Both counties also experienced an increase in infant mortality rates in 2022. Guilford County has partnered with Forsyth County in our Improving Community Outcomes for Maternal and Child Health state grant from the North Carolina Department of Health and Human Services. Guilford County has implemented that grant for the past 2 years. However, when we began submission for another 2 years of funding, we realized that our disparity ratio had dropped 10%, which made us ineligible to submit as a sole county. We've partnered with Forsyth County for the fiscal year 24 through 2026 since they qualified, and so we can replicate programming for the same impact in Forsyth County. Next slide. Our rolling 5-year infant mortality rates over the past 10 years are showing a slight overall improvement of 4.4% for Black infants in Guilford County. If we look at 1-year infant mortality rates, we are showing a 22.5% improvement for Black infants since 2018. Both white and Hispanic infants, however, have experienced an increase. Demographically, there's been a slight increase in the percentage of Hispanic infants born in Guilford County since the 2019 data. In 2019, Hispanic infants made up 14% of total number of infant births, yet in 2022, that percentage increased slightly to 16%. Also in 2019, Hispanic infants made up close to 4% of infant deaths. However, in the 2022 data, Hispanic infants now make up close to 20% of infant deaths. We're wondering the full impact of COVID, particularly for our Hispanic infants. We're also looking at the other reason for increase in Hispanic infant deaths could be a result of the state now using a combined race Hispanic status measure, whereas our previous data was based on separating race and Hispanic status. Moving forward, the data comparisons from previous years won't be completely interchangeable, and we'll have to pay attention to the differences from 2022. Next slide. Every Baby Guilford is using 3 measurements for defining our success towards reaching our bold goal that include late or no prenatal care, preterm births, and low and very low birth weight. As you can see, for Guilford County as a whole, since the 2020 data, we've experienced overall improvements for Black birthing people reporting late or no prenatal care, decreasing by 8.4% since the 2020 data. We've also had improvements in preterm births and low birth weights for Black birth outcomes. Preterm births have also decreased by 15%, and low birth weights have also declined by close to 14%. However, the number of very low birth weights have increased. Next slide. Here we're looking at Guilford County experiencing some wins with regards to reducing rates in all 4 health indicators when looking at health outcomes across all race. It, however, remains that Black women and their babies are continuing to do disproportionately worse than white women and their babies in all 4 health indicators. This demonstrates that there's still work to be done. Next slide. While Black babies continue to make up the largest proportion of infant deaths in the county, there was a 21% decline since 2021 data. In 2022, Black babies made up 39% of the births in our county, similar to the year before, but 52% of infant deaths. In 2021, that was 66%. While it is exciting to see this decrease for Black families in our county, our Hispanic infant deaths have increased, doubling in number from 5 in 2021 to 10 in 2022. Since we launched in 2021, Hispanic infant deaths have increased at a rate 4.4 times higher. Again, we're looking at how the state is pulling that data now as compared to in the past. The state does have a disclaimer for total infant deaths by race that the sum of deaths for racial ethnic categories may not add up to total deaths due to missing and undetermined or unclassifiable race information. There was, in fact, 1 reported infant death where the race was not reported. So whereas we had 52 deaths in 2022, when you look at everything by race, it may not, I think it adds up to 51. Next slide. So as a result of this data, then in June 2021, when we launched and continues today, next slide, the data continues to drive the need for a radically inclusive collective action movement. The Every Baby Guilford team is simply a backbone support entity working in the community, including people impacted by and impacting our groundwater challenge, which are maternal and infant health inequities. We are building a collective with the community, with you, not for you. We are co-designing and partnering to implement collaborative groundwater solutions. Together, we want to disrupt longstanding racial disparities and achieve our common purpose. By 2026, we will work collectively to ensure more Black babies are born healthy and live to celebrate their first birthday. Our collective action is a process of continuous learning, doing, and improving that is necessary to create collective impact together. This work is rooted in relationships, shifting how and with whom we work to ensure common purpose, power, trust, and resources are shared among those most directly impacted by and impacting our groundwater challenge. Next slide. As a reminder, we set a bold goal that we intend to improve health outcomes and decrease racial disparities through the following health areas by 50%, increasing the number of pregnant individuals who receive prenatal care before the second trimester, increase the number of healthy births by reducing the number of preterm and low birth weight births, as well as increasing the number of Guilford babies who make it to their first birthday. Next slide. The central organizing piece of our collective is our collective action framework, and it's our common purpose to achieve population and system level change. In blue are the foundation principles of our collective action work. These are how the components come together, and these principles guide our collective action initiatives toward their common purpose while ensuring a focus on practice and advancement of equity. They guide learning, design, and implementation throughout the lifetime of the initiative. Next slide. So you can see where we are today. The plan mapped out the first 5 years of Every Baby Guilford as we began implementation, and we are now transitioning into phase 3 as we wrap up year 3. As July 1 will launch year 4, I want to remind all of us that this is collective action together that will move us to the collective impact of reducing racial disparities in maternal and infant health, so that more babies will be born to live and celebrate their first birthday and beyond. Next slide. We're now going to spotlight one of our programs, the Fetal Infant Mortality Review. We are the first county in the state to implement a FEMR. So let's take a look at what a Fetal Infant Mortality Review is and its impact on our community.
Good morning. My name is Leandra Vernon, and I'm a Fetal Infant Mortality Review Coordinator with the Guilford County Every Baby Guilford program. I'm grateful for the opportunity to briefly share with you what a Fetal Infant Mortality Review, or FEMR, is, and how FEMR helps us to better understand the issues associated with fetal and infant mortality and morbidity. FEMR is an action-oriented, evidence-based community review process that looks into all the circumstances surrounding an infant or fetal loss to find systemic solutions to problems the family experiences. Vital statistics alone can't tell us a story, but FEMR does. The process provides context to the life of the parents, the family, the healthcare system, and the death of the infant. The goal of FEMR is to decrease infant mortality and disparities through record abstraction, family interviews, case reviews, findings that relate to the root causes, and recommendations and initiatives to improve systems of care. The process leads to local, state, and national prevention actions. One of the unique aspects of the FEMR process is the inclusion of the family interview. To fully understand the factors surrounding preconception, pregnancy, labor, birth, and infant health and well-being, it is essential to understand the way things happen from the family's perspectives. FEMR teams consist of racially and culturally diverse teams that work in collective action. Members also include persons with lived experiences and those who have used the services within the community. Besides the valuable information obtained through the FEMR process, FEMR also has a fundamental opportunity to build internal capacity and uplift their community through prioritizing health equity and data collection. FEMR also helps to build a community coalition that represents the diverse ethnic and cultural experiences and perspectives in the community. FEMR programs support collective action teams. And more than anything, we know that FEMR provides more than simply identification of disparity, but it gives us a framework for determining root causes of persistent disparities and access to and the delivery of care. The knowledge that is gained through the reviews will empower communities to enhance services, influence policies, and direct planning efforts that will ultimately lower infant mortality rates and reduce disparities. Guilford County is committed to making a difference in the lives of our youngest and most vulnerable residents and their families. We believe that together we are building healthier communities and improving birth outcomes for all. Thank you.
I would now like to introduce Danielle DeShazer-Tab, Prenatal to 3 Project Manager with Ready for School, Ready for Life, and EBG's former Perinatal Health Coordinator, who will share how our partnership supports the Community Action Group of FEMA. Next slide.
Thank you so much, Jean, and hello to everybody. I'm so excited to be here and to see so many familiar faces. I'll wait just a second for the presentation to come back up on my end. While she pulls that right up, I'll jump right on in. So tell you a little bit about us. Ready for School, Ready for Life, also known as Ready Ready, is a collaborative effort to build a connected, innovative system of care for Guilford County's youngest children and their families. You can go to the next slide. Our goal is to support families through the first 5 years of life to improve kindergarten readiness. I specifically focus on initiatives prenatally to age 3 because 80% of brain development happens in the first 3 years of life. Research shows that this period is critical for children's future health, learning, and success. During this time, the brain forms connections that are essential for higher level abilities like communication, problem solving, self-regulation, and motivation. They also lend to survival, learning, and social and emotional development. And we want to ensure we are equipping families with all the resources they need to support them in their parenthood journey. And I have the honor of supporting the initiatives that focus on providing that support and connections to resources. So I want to tell you a little bit about one of my favorite projects to work on, and that is Roots to Ready, which you can go to the next slide. Roots to Ready is a collaborative system of care that consists of 4 community partners: Nurse Family Partnership, Family Connects, Healthy Steps, and Community Navigation. Roots to Ready is for parents and caregivers to connect with a Roots to Ready partner prenatally or early in childhood, often through their medical provider. They partner with the family to map out each family's unique situation, because we know every family is going to be unique. There are no two that are alike. They're just like snowflakes. And so together they set a course with each family to the most appropriate Guilford County resource, and ongoing support and regular check-ins are provided through age 3 to help families throughout their journey. We like to say that Roots to Ready is families set that direction, and Roots to Ready is just there to support and help them get to that location at the end. And so you can go to the next slide. Today, I want to specifically talk about community navigation. They play a key role in supporting our families before and after birth. We have both prenatal community navigators who connect with families at their OBGYN office, and postnatal navigators who connect with families at their pediatric offices after their beautiful bundle of joy is brought into the world. During those sessions with community navigators, they have conversations with parents to help identify strengths and needs for families and areas of risk across a range of domains and factors. Community navigation works with that family to prioritize the areas that they want to focus on first, or that they feel is most urgent in that moment. Once those needs are identified, and the navigator uses our resource database called the Agency Finder to find the appropriate resource. The Agency Finder is a directory that is integrated into the Community Navigator's system so that they can make and document referrals to services to meet the prioritized needs. Community Navigation follows up with families to be sure referrals have been secured and the referral meets the needs. You can go to the next slide. An important component of community navigation is community alignment, which is headed by our network engagement specialist, Felicia, who works closely not only with community navigation, but also other Roots to Ready partners, because they all utilize that Agency Finder. And we are ensuring that we are building out the most comprehensive resource directory possible with that Agency Finder. Felicia maintains and updates the Agency Finder so that all the information in it is accurate and current. And as it stands today, we have over 300 resources between High Point and Greensboro. What's great about the partnership is that community navigation can reach out to Felicia here at Ready Ready to let us know about any gaps or update the agency finder as needed. And through that communication, community alignment and community navigation are able to come together and address any gaps that are identified. In the past, we've been able to address gaps like the need for diapers or safe sleep material. And right now, we're actually working on filling a car seat gap that was identified in the community. So if anybody has any information they want to share, we are happy to take that as well. And in the not so distant future, we plan to have a prenatal to 5 system alignment committee, which will address more complex gaps like housing and transportation as we develop more complete data. An additional part of our future vision is to share the agency finder more broadly so that our community partners can utilize it and potentially collect data that supports a deeper understanding of community needs. Currently, we do have a community portal that is accessible to our partners and families. If anyone is interested in learning more about that community portal, which is the community-facing version of that agency finder mentioned, I'd be happy to connect you with Felicia so that we can get that information over to you. You can go to the next slide. Now you might be wondering, how does all this connect to FEMUR? FEMUR allows for a system level look at what's impacting infant mortality and highlighting the immense need for this system to work well for families to ensure that they're directed to and they receive the needed resources. So I've been a member of FEMUR since it started, because as Jean shared, I formerly was the perinatal health coordinator. And because I've been a part of that group and have that perspective, it allows us to address gaps with a more rounded view and it really helps us with action planning. For example, FEMUR was able to create a list of recommendations that we hope make a positive impact on infant mortality, of course, and early childhood development. And after receiving those recommendations, myself, other members of the FEMUR team, and community navigation were able to come together and look at those gaps to figure out where community navigation could support those birthing folks coming into their new journey of parenthood, or even if they were further along in it. We were able to still connect any gaps that community navigation couldn't cover. We were able to connect with other community resources that we knew about and just have that really thorough brainstorming and planning session together, which was a really, really nice combination. So we will, excuse me, so we will continue to build the connections and work upstream with FEMUR to ensure that every family has the best start to life. This work is really collective action in motion, and I'm excited to see how the work we do today impacts the future experiences of families. Jean, thank you for the opportunity to talk a little bit about FEMUR and how FEMUR is impacting the community, impacting my work. And if anyone has any questions, you can go to the next slide. Our contact information is there, and feel free to reach out to us if you have any questions.
Thank you, Danielle. Ready for School, Ready for Life certainly is our umbrella organization that we fit up under as a collective action movement, creating that well-coordinated system of care. When 38 recommendations came out from the case review team since the launch of our FEMUR, many of those recommendations were in that navigating referral space. And we knew the group to tap into that would be our community navigators and community alignment that's working hard to ensure all of our partners and individuals know about resources available to them, but more importantly, how we secure those referrals that are being made to ensure families are getting what they need. Thank you, Danielle. Now we get to turn it over to a community spotlight. We're going to stop sharing the screen, and we're going to let Jania upload her slides. Jania Williams is the director of the North Carolina A&T Human Lactation Program. And this program is doing extraordinary work in our community to build a well thought out system of care within the breastfeeding space by training individuals. So I'm going to let Jania talk more about this program.
Hey, everybody. Thank you so much, Jean, for inviting me this afternoon. And it's good to see everyone. I know that we often get to interact with one another in virtual settings and spaces. So I'm excited to be able to do this with you all today and just update you on a little bit of the work that we've been doing at the Human Lactation Program at North Carolina Agricultural and Technical State University. So I think the last time I saw everybody virtually was in 2022. Um, and I know that you all have gotten a chance to meet with Emma and Jessica in that time. So you probably know that we have grown as a program area, and that is definitely due to some of the funding that we received from our partners at Every Baby Guilford. So thank you so much for that. We were able to add Emma and Jessica. So this is kind of what we've been up to. Just a brief overview. We are still the only Pathway to Human Lactation program at a public HBCU, but that's okay because we are actually assisting, providing rather technical assistance to other HBCUs that are onboarding these Black maternal and child health programs, including lactation. So far, we have graduated 42 individuals, and these are the classes from 2021 until 2024. We have approximately anywhere between 10 to 15 students in each cohort. But with those 42, minus the 9 who just graduated last month, we have more than half of those individuals working in the field of maternal and child health spaces. And moreover, we were able to retain about 80% of those individuals within the state of North Carolina, and they're working in maternal and child health in Guilford County and Forsyth County. In fact, we have about 7 of them working at Atrium Wake Forest Baptist together. So that's really big to have that many lactation consultants from underrepresented communities in one hospital location. We do have students, though, who have decided to continue education. 3 of them went on to pursue graduate master level degrees at Carolina and at Brown University, and they both also received full rides. And we have 2 students who are finishing up their terminal degrees, getting their PhDs, and their dissertations involve lactation for Black maternal and child health. Also, I just wanted to highlight some of the things that we were doing in this past year as far as the program is concerned. And you're probably like, why is she telling us this about the program? Because in everything that we do, we talk about the work that we are doing with the community. And we talk about how you can get involved in your local health departments by ways of just making those simple connections. And when we're doing these presentations, a huge amount of the questions that the audience has for us afterwards is, okay, how can we replicate something like this? So I was able to do that on an international platform this spring by closing out the Gold Lactation Conference. And I was able to speak with those individuals at the conference about how to start a community-based clinic and how to connect with providers in the community. Emma was able to host a 2-hour workshop for the National WIC Association, where she was also able to speak with WIC partners and letting them know, hey, you should encourage your lactation team to further education. Let's brainstorm of some ideas of how we can fund these ideas and move forward with securing more IBCLCs at WIC. Jessica, who you all met, was able to host a 1-hour workshop at the Bloom Collective, and that is an organization based in Baltimore, Maryland, that has roots with Johns Hopkins and Morgan State. Our team was able to publish in a nursing clinics journal, and we also spoke about our outpatient clinic there. And then we did some podcast interviews, again, providing that technical assistance to other HBCUs, connecting them to community resources. And then 2 of our students, we have a community health worker now, as well as Jay Chu, who is at our Guilford County Health Department, was the first to receive WIC funding from National WIC to assist her with her educational journey in completing the Pathway 2 program this year. So, what other things have we done with the funding that we were given from Every Baby Guilford? Well, Every Baby Guilford was able to fully fund 5 of our students' education and help them join the maternal and child health workforce. We have another student who will be the recipient of the 2024 scholarship this year. We were able to receive seed funding for our outpatient clinic. And when we pulled the metrics last week, we've been able to serve over 202 patients since 2021. And a lot of these individuals are able to come back to us as repeat visits because they feel very comfortable and open and welcome and just able to be transparent in our clinic and providing them with those lactation needs. We are also in the community navigator, the finder, agency finder now with Guilford County. And so we have providers directly sending patients to us, and we are providing prenatal education for lactation and postpartum support for the doulas associated with the Every Baby Guilford doula community doula program. Every Baby Guilford has assisted with funding our fall and spring workshops for our program, as well as, and I apologize for admitting this, our students go through a Riot for Change DEI workshop, and that's part of what our fall workshop is. And so Every Baby Guilford has assisted with providing us seed funding for that. And I think our biggest adventure, besides that community clinic, is coming up around the corner. We are hosting the Uplifting Black and Brown Lactation Success Conference here in Greensboro, North Carolina, August 7th through the 9th at A&T's Farm Pavilion. So we hope to see everybody there. I'll be able to send out information in the next few slides about how to register for that. But we have one or two, excuse me, rather large Black lactation conferences, and our organization that assists us, Rose Reaching Our Sisters Everywhere in Atlanta. We call her Dr. Mama Bug, is retiring. And so she sought out the program at A&T to assist with moving forward with the Black Lactation Conference, one of the Black Lactation conferences. So we're doing that. So what are we going to do next, right? So since we were able to sustain our program with funding given to us by Every Baby Guilford, these are some of the things that we have coming down the pipeline. I know that we have big dreams in Guilford County, so we are ready to assist with achieving those goals. We are seeking to creating a Black Maternal Health Center of Excellence. Currently, those only reside at the HBCUs that have medical colleges or institutions associated with them, but we are building so much Black maternal and child health programming at North Carolina A&T. We are going to step up to the plate and assist with doing that next. We heard you, community folks. We understand that not everybody has a bachelor's degree because we did put the program into the graduate school, but we are looking to start doing training for community folks who are going Pathway 3 and accepting Pathway 3 students during the summers while we are off from the academic calendar year. And we are looking at becoming a lactation education training center as well by building out curriculum for our providers. And last, these are just some of the things that you can do to follow us. We are now on Instagram. This is the flyer that we have out. It's circulating on our IG with the link to register to attend the conference. So far, we have over 56 folks who have registered. Registration does close, though, on July 11th. And then we are still having our free lactation clinic. Again, community, we heard you. We are piloting evening hours for the summer to meet the needs of our working families. So on Thursdays, we are open from 1 p.m. until 7 p.m. And we are still open on Tuesdays from 9 a.m. to 3:30 p.m. So thank you so much for allowing me to come and present today, Jean, and everybody at Every Baby Guilford. And I look forward to continued work with you all.
Thank you so much, Jania. Talk about change agents in our community and the impact that this program is making. While we have disparities in infant mortality, we also have immense disparities in initiation and continuation of breastfeeding in our Black communities. And North Carolina A&T, through the Human Lactation Program, is making an impact to change that disparity rate, to change that statistic in our community. So thank you for the work that you're doing in our community for every baby and family. So now we like to brag on ourselves sometimes, just a little bit, and we pull together, thank you to our Hey Awesome Girl team, an accomplishments video. This is meant to be for the last 12 months, but of course, 12 months doesn't end until June 30th. So if you see some numbers that you're a bit off, we probably have gotten a little higher in the numbers, but nonetheless, we want to show you a few accomplishments of what Every Baby Guilford and the community has been working on in the past year. Pull up that video. All right, we are now going to transition. I'm going to turn it over to Consuela Green, Root Cause Institute's one of the managing directors and our lead consultant, and she is going to work with us with a panel discussion of having a crucial conversation with community members on some of the key takeaways from today's conversation.
Awesome. I'm gonna give Kim a minute. And while we do that, I'm gonna pin those of us that'll be in this conversation together so it's easier for folks to see us. Let me just do that real quick. Can I pin more than one person, Kim?
I'm not sure, but everyone should be able to see the screen that I have that has everyone.
Okay.
I can
All
see
right.
it.
And then I guess as we talk, it'll pop up. I was trying to figure out a way to feel like I've seen someone pin more than one person at the same time in a webinar, but you know, we're figuring this out as we go. So again, thank you, Jean, for inviting me to just moderate a community conversation. But I'd love to have an opportunity to invite Javon Johnson with the Peculiar Dad Network, Nakia Brooks, one of the amazing health ambassadors in Guilford County, and Quadasia Sharp, one of the amazing community doulas through the Guilford County Community Doulas Program, really inviting you all into a conversation with each other and with those that have joined or will watch this crucial conversation later, as the recording will be shared as well. One of the things that I would love to maybe start off this conversation is just some general introduction. So if each of you could share a little bit about what some of the roles or the work that you've been doing that you're really representing in today's conversation today. So I'll give a chance, I'll start with Javon and then go to Nakia and Kodeja.
Awesome. Good evening, everyone. Hope you all can hear me. It is the last teacher work day of the year. So I'm also an educator in different high schools. So here's a whiteboard behind me. Don't worry about that. Hope you all have a great day. Javon Johnson, the founder and executive director of the Peculiar Dad Network. We specialize in education, encouragement, empowerment of fathers. We're also leaning very heavily into training family programs. And so grateful for Jean and the entire EDG team. Over the last year, we've been able to go in to help train their ambassadors on campuses while also partnering with them as it relates to training of family programs. And so what we've been doing over the last year is really leaning into the data as it relates to paternal presence and paternal inclusivity. And so if you are a program that serves families, we also believe that it's very vital that we lean into training and developing our amazing fathers as well. So I'll make sure working my sound as you all continue to go into the panel session.
Awesome. Thank you, Javon. Nakia?
Good afternoon, everyone. My name is Nakaya Brooks. Thank you again so much for having me. It's so great to be here and get to have this shared virtual space with everyone today. I am a rising junior attending North Carolina A&T, and I am representing Every Baby Guilford as a perinatal health and social media ambassador with the community. It's been a great experience since the beginning of the year, and I've been able to engage so much with my community in ways I haven't before. So it's great to have that. I'm great to be here. And I'm also a CNA in my hometown in the Women's Health Department in Maryland as well. So thank you.
Awesome. So glad that you're here. And Kodeja?
Yes, so I am Qua Sharp. I'm representing Every Baby Guilford. I'm a Guilford County doula. I am also, I've been a social worker for about 10 years, so I am a therapist as well. I'm also very grateful and thankful to be in this space with everyone. I'm grateful and thankful for the opportunity as well.
Yes, yes. So thank you, each of you, for both your introductions and give a little bit of flavor for some of the work that you're doing in Guilford County. And so I want to do my first question is really a little bit of a flashback. As Jean said earlier, the data that was shared earlier in the session is from 2022. We are in June 2024. And so this is the interesting thing about public health data, right? It is always a little bit behind from where we presently are. But I think it's important in a community conversation for us to both look back and think, well, back in 2022, what might I have been up to? And how might have been connected to some of the things that were underway then. But even more importantly, as each of you all think about your work and as it relates. So Every Baby Guilford's core sort of bold goals is to really address the racial disparities in maternal and infant health outcomes. So everything from reproductive health, more generally, sort of before someone becomes pregnant. So when I think about the work that Nakia is doing, like that is really a critical part of Every Baby Guilford's work. It's how are we engaging with young adults or folks as they're starting to figure out their reproductive health journey? What might we be doing to really enhance that from a collective action perspective, all the way through pregnancy, birth, and that first year of life for babies born in Guilford County. So that's what Every Baby Guilford is like, moving with others and partners collectively to really address. And so when you flash back from 2022 or whenever you may have felt like you started to kind of really occupy this space till now, what are some ways that your work, I'd say your work and your community action connects to Every Baby Guilford's bold goals? And you answer that question however you would like. For folks that are listening in, I said to the panel, like, we are really just in a dialogue together. So I didn't want them to feel pressure to like do too much preparation, but really just from where you sit, when you think about who you are, the work you do, and the importance of community action, what are some things that you've been up to that really connect to Every Baby Guilford's movement? And anyone can jump in first.
Well, so 2022, I feel like I was like, I just received my donor certification, just took my training. So I feel like I was like, foot was wet, like getting in the door, just newly experiencing, although I've had some previous experience, like in the being a doula, just had not received the training until 2022. So now I think my goals and just being a doula, it just aligns very well with Every Baby Guilford, especially just providing education to clients, about pre-pregnancy, pregnancy, childbirth, postpartum, what that looks like, providing them with like resources, because a lot of times they don't know the available resources in the community. I think it's very important as a doula to, I do a social determinants of health. I think that is also very important as a doula because of a lot of things, can be assessed and determined when we are assessing for needs, and trying to figure out, like, yes, you're pregnant, but are you able to go, get to the doctor's appointments? Do you have transportation? Right? Like, is that a concern? Is housing is housing a concern? Other concerns that can impact risk and infant mortality and things like that.
Mhm. Thank you. Others?
Yeah. So in 2022, hope y'all can hear me now. In 2022,
Yeah,
we
better.
had
That's better.
good. We had an amazing 3-year-old child, right? And so we were right in the thick of it with a 3-year-old, and really having a personal touch with the work that EBG is doing. My wife had just come over her time with postpartum anxiety and depression. And so we were navigating all the things as relates to being new parents and really leaning into making sure that her well-being was there, but also I saw our child's well-being was there. And so everything for Peculiar Dad has been about building a community of fathers that are advocates. And so I was trained along with my wife through the amazing program as a doula, right? I was a full spectrum doula, probably one right now, still in Guilford County, males right now. And I began to kind of put those things into action. And so building the community of men or fathers who weren't just bystanders, but really truly advocates, aiding and assisting their partner, their wife, their fiance, through the process of bringing a child into the world. And so since then, it's been all things education towards dads and making sure that dads feel comfortable in that space as advocates. Ultimately, that plays a long-lasting role in to make sure our moms and our babies are taken care of as well. So 2022 was a year of me as daddy, but also a year of building strong community for our fathers.
Oh, thank you so much. Nakia?
Yes, so 2 years ago seems like it wasn't really that long ago. It sometimes feels like it was just yesterday. I definitely had just graduated high school, and I was in Maryland. So taking that big transition and coming from Maryland to North Carolina was such a great opportunity for me to attend college and all those great things. And one thing that I believe has definitely engaged and brought the community more is just more communication. I think communication, especially in today's time, is just really, really significant in getting anything. You can never have too much communication, but you can have too little. So I'm always advocating for more communication between peers, coworkers, managers, all good things. So yeah, and also social media influence has as well been a really big opportunity in engaging that with the community where because of COVID, we weren't able to, really talk to anyone but then our phones and our electronic devices. So in order to, communicate now with the community, we're still attached to clinging onto that kind of communication. So being a social media influencer and the generation has just been more prominent in getting the younger generation to really engage with, what's going on in today's world, in today's time. But also, there's been a lot of local events that's been happening within Guilford County that have showed great ways to share to the community. And I've been a part of some as well, where I was able to share reproductive life plans with people of all ages. And it's basically a general concept map to show anyone questions of whether or not they're ready to have kids, whether you want to or not. It gives you a broad questions of what to think about, what to plan, what to really interpret into your current life so that you can plan to do this further on. And so, yeah, I've been able to help with that and share that to the community and to the organization as well.
And one thing that I'll say, and what is really important and powerful when I think about the health ambassadors and sort of the just everyday community folks, right, that are getting trained with enough understanding and access to enough information to, because there's, when we go back to that Fish Lake groundwater analysis of like things that are individual focused, things that can really impact community and things that really cut across systems. When we think about our life and we think about individuals and families that are on their journey, so often we're getting information sometimes from a lot of different resources and sources. So the power of having more individuals in the community that are aware of tools, resources, access to services, and able to help people that are near and dear to them. So people you care about. I think a lot about the power of sort of circles of influence when I think about collective action work. So the role of being a health ambassador, and each of you, the roles that you all play, both in your work to really educate the community, help build individual folks' capacity to make decisions or at least know how to navigate some of the things in front of them, has such an important impact in what we do as a village, right? As a group and community of people as well. So my next question is really leaning into this idea of collective action, right? So I remember early on when we were in the strategic planning process for what is now the strategic priorities for Every Baby Guilford. And everyone said, like, you know what, we've been working on this stuff for decades. Not much has changed. It is important that we name systemic racism as the clear driver and contaminant of what is driving these racial disparities in maternal and infant health. That was very, very clear. So back in 2020, and I'd say since then, there's been some real intention of we can't just keep doing the same thing we've been doing, but there's got to be a both and approach to this. Individual services and programs are critical and important to individual people. It is not to negate the value and importance of quality healthcare, quality maternal and child community supports. Those things are critical and important for families. And there was a strong call for how might we better center community, bring more people into both the conversation, but also into creative solutions so that we can start to really see a difference at a community level in the outcomes of maternal and infant health. So that was a core driver for Every Baby Guilford's work. And when each of you are doing different things, right? So no one's trying to do the same thing. Everyone doesn't have to all be doing exactly the same stuff. What advice would you offer to your peers or others in the community that are either a part of this collective action movement work or maybe doing some work connected to it, but may not know quite what they should be doing or could be doing? From where you sit, what would be advice that you would offer to folks in the audience and beyond, in particular, people that are really impacted by the maternal and infant health outcomes and those that are impacting it, right? That are driving it and shaping it. What advice would you give? Maybe one or two things that you'd love to share with folks as advice to be a part of or continue to strengthen the movement work that we're doing together. Javon, I see you
Um,
talking.
I'll jump in. I'll jump in there. And so the frightening thing is the data is real, right? Like that's I want to just kind of the summary of all the data we just seen over the last hours that the data is real, and that we can't witness the data and act as if it's not there. And so now all of us, no matter what role we play, have now been charged with doing something about it. And so whether you are in my seat, in my colleagues' seats right here, whether you're in Jean's seat or someone in her staff seat and you're getting paid for it or not, everyone now has been tasked to do something about it. And so I think the number one thing for me is partnership. Oftentimes in a community like this, where everyone has great ambition, is that we'll get lost in our own sauce and begin to create silos of work effort. And I'm bold enough to say it here. I'm bold enough to say here that we have to be partners. At the end of the day, these are our sisters and our mothers and our aunties and our cousins who are passing away, and our babies who are dying without seeing their first birthday, and our friends who could potentially be friends, and next lawyers and attorneys. And so now all of us, no matter our race, no matter our demographic, no matter where we come from, have a charge to do something about it. And so my role may be to ensure that I charge and petition the fathers in our community to make bold moves. I love when Jean says we have bold goals. I'm like, yeah, they are bold. I mean, they're big, right? To eliminate, to eradicate. But the problem is that why are we even having this discussion? like why are we having a discussion about the fact that there's racism found in the system that's causing for these things to happen? And so all of us now have been charged to do something about it. So first thing is partnership, is to find someone along this list of people who are here and ask, what can I do? How can I partner with you? And maybe you don't have time, but you have money. Maybe you don't have money, but you have time. Maybe you don't have time or money, but you have connections and people around you, right? I think all of us have been called to do something about it. I'm gonna give one data point and I'm done talking, y'all. I can't talk. A study published in the American Journal of Public Health found that fathers' involvement in prenatal care is associated with improved maternal health and behaviors and birth outcomes. My second thing to you is let daddy. Let daddy. The reason why I love EBG so much, and I have a strong care for Jean, is because they've allowed me into spaces to educate individuals on the power of paternal involvement. Is that imagine if we pushed our dollars and our support behind ensuring that our men in our community, how would they need to be successful? How they need to feel as if they can add some value to their families. It will make my job a lot easier. I'm having a conversation with a guy about the fact that he's just trying to figure out what role he plays in his household. What role can he give to his children, right? And so partnership is very important, but also paternal involvement is also very important. And this is not the let down of maternal care and concerns or infant mortality at all. But if we uplift paternal involvement even more, we can see the eradication of those things as well. I believe that. And I also think the data is also proven that as well. So thank you.
Absolutely. Others?
I was just jotting notes while my brother here was speaking, because I feel like I have so much to say. I feel like I have like so much to say, but one, I do agree that partnership is very important. The collaboration is very important. Like we can get, so much further with like numbers of us versus just one person. Working together with healthcare providers, community organizations like doulas, advocacy groups, very important. But I also have, like, as a doula, I think it's important to educate the birthing person about birth rights. Right? Like, I think that's very important to talk to them about birth rights, to talk to them about grievances, what it looks like, how to file it, right? I think that's also important in this work. I think it's very important to be a support person, but also to be a safe space, right? Because that's huge in that birthing room, just to be a safe space for someone who may not know, you know, may not know, right? Like may not know medical interventions, may not know medical terms, may not know, what is the fetal monitoring, right? Just providing that education and providing that safe space in that room, and eyes and ears, 24/7, all, from admission to discharge. I think that's very important. And even after that, I oftentimes think about with infant mortality, and maternal, mortality, like how many of them are 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 passing, how the number of this that's happening at home, right? Like, what's the percentage of, infant mortality, or the birthing person passing away at home, or stillborn, or having the miscarriage? I think about that. I also think about my sister who, lost her baby. She had a stillborn. I think about that every time I'm in that birthing room, because it's powerful, it's impactful, and it trauma carries, it's a lot. So I think about that, and just continuing to advocate for like policy changes. That's very important. I think about, from like systematic reforms, like addressing these things on the systematic level, like it's systems, that need to be addressed to get to like the root cause of all of this, which we all know what it is, right? But policy changes definitely help. So advocating for that, is another big one.
Mhm. Awesome, thank you. And Nikhil, when I think about, like you said, yes, right, to being a peer health ambassador in your first years of college. So I'm really curious from where you sit, what were some of the things that one made you say, this feels like something I might want to be doing because it connects for me, but advice you may have for others in your sort of peer group as well, for how to get involved and be engaged?
Yes, of course. So a little bit of background information. My mother, a few years ago, before COVID, actually had an ectopic pregnancy, which never had happened before in our family. So definitely want to emphasize, now being able to have the resources, the information in my hands and what to do with it. Definitely just spread the information. And again, to family members, friends, families, because there's a lot of um, information to know about, but the right information is what we need to know about. I feel like in today's time, there's a lot of misinformation, there's a lot of distrust with certain wherever you get your information at. I'm sure you all know. So it's definitely just really important to share the correct information, the right information, and get it to, everyone, because we don't know. Like, piggyback to what my peer was saying, it can happen at home. Most of it is at home. Um, and it's definitely a great opportunity to speak up about it and spread that information, but also to support one another, supporting these mothers, supporting these fathers, in this new change of their life. I believe support is so significant. This past month, I was able to share resources with maternal wellness in Black women, especially, and just to let them know we're here for you, we care for you, we embody all these resources, for you, and we're here with you every step of the way in this beautiful journey that you're engaging with, in both ways, in both grievance and things like that. And especially if they don't have the support, at home or near or around them, definitely spread the information out and let them know that, hey, we're here for you. And I think that's definitely important being so young. Just being a junior in college is definitely, we spoke about the teen pregnancies and pregnancies within college, because it's definitely a little taboo, but North Carolina A&T has done a great job in encouraging, safe sex, encouraging this program called Healthy Brothers and Sisters, where we all come together, engage on knowing all of the information about wellness for our reproductive life planning. And so again, spreading the information is the really crucial part in engaging with the community. For example, I was able to help a girl in high school with her essay, and we actually had the same English teacher, ironically, and I was able to help her on our topic essay about oh my gosh, I am so sorry. I had helped her with maternal mortality rates. Thank you. I am so sorry. It's such a jump of words, but yes, maternal mortality rates. And I was able to help her find resources within Guilford County and my own county from where I grew up in, and help her get that information out to her to get her have a good grade, but also share that information with, small towns from where I grew up at as well.
And that's a huge piece. So I know, I mean, I shared with you all, we were going to have a quick conversation, and I'm going to be mindful of time, but there's a couple of things that I want to lift up that I heard from each of you all. One is the real importance of partnership and collaboration. Another piece, the importance of, as individuals, us knowing enough and being connected enough to information that we can really share and offer to our loved ones, to peers, to other folks around us, becomes a really critical part of this collective action work. And another thing that I would just say, and Jean has heard me say this before, and any chance I get to say it in public, is like, there's gotta be more village behavior, right? We've gotta see this issue. Javon, you said it perfectly. Like, you can't see this data and not remember that these are families. These are not just numbers. As a woman in a Black female body, so often when I see public health data, it breaks my heart.
Yes.
And so I want us all to remember that however the numbers shift or change over the years, we are all called to take some responsibility from that sense of community and